Live, and we're going to be talking about uteral function and how it sits in reference to the hips. So we're going to start off just by showing some diagrams, and then we're actually going to go right to the work. We have Dr. Aegis Sun here, we have Get Fit with Britt, and we have Keith, who is on property here. So we're just going to be going through this and sharing it with you guys if you want to take a look. So what we're going to do is we have the female anatomy here. And what I've done is I've removed a whole bunch of parts in here so that we can look at it a little easier. Look at the hips and then look at the inside. So I haven't put the intestines in here, but I will for a second. So I want to show you so when we have the digestion in here and everything else, this is greater omentum, you're going to see that the small intestine here sits right down there. Now, if somebody has their belly coming out a little bit, protruding out this way, you're actually going to have pressure in here on that ligament. And that's the ligament that goes over top of the uterus and the bladder. And so if we were to take this out, for example here, you can actually see the fallopian tubes, and you can see this. Now I'm going to isolate this just so you can see what it looks like. That's what it looks like. And you can see, what I want you to notice is that it's attached right to the muscle skeletal system. Actually, there are muscles that go through here and fascia that goes through here. So it's all fascia, all muscles. And so it's attached. So if the pelvis is off slightly, that means that this lining is off slightly adapting. So and there's not a person that I know that wouldn't have this lining off, because everybody's hips is slightly off. I've never seen anybody who had perfect hips. Okay? So if we were to remove that, okay, Now we have what we have is the bladder here, and there's a lot of you can imagine this. So if you have your hips off, that's going to also cause the bladder to be slightly off. So this is where sometimes you'll get leaky bladder, or you'll get a bladder issue if the hips are off too far. You'll get a bladder issue that's significantly off, or like a lot of times, like women will say, if I'm jumping on a trampoline or something like that, I have leakage. Well, that's one of the reasons why, because where a guy doesn't have that, ligament over there. So that ligament is attached to the pelvic floor, and if it's up or down, it's creating pressure that the male wouldn't have. Okay, so if we take out the bladder here and get rid of it. Okay, now what we have is in there we have the fallopian tubes that are right here. And we have the uterus. Now, if I could take out, to separate the uterus to see it from a different angle, I think the best way, I'm not going to be able to show you the different angle right from here, but in here you can see how the uterus goes, and it's a hockey stick shape. So it goes like this and down like this. I'll grab a pen here. So the uterus goes like this and then down like this. That's actually the shape, and the fallopian tubes go off of there. Do you guys see that? Mm-hmm. Right in there?
Yeah.
So you can see where it curves right there?
Yeah.
Okay, right in there, how it curves up in there. So what would it look like if this lady had, here, let me get rid of these guys. I thought I got rid of them all. I was racing all the muscles off of here. I'm like, how many damn muscles in the arm? Okay. So let's pretend that a lot of women have an anterior pelvic tilt. A lot of people do, but a lot of women. Okay, so let's say that anterior tilt means that the pelvis is tilting back this way. So it's rotating back. So it's literally sitting like this. So if that sits like that, and remember that this, here, I'll take off the muscles here too, so we get a better view. So right here, these are the 4 layers. So again, if we have that ligament in there, remember this had the ligament in here that crossed all through here, that went on top of that. So if that ligament is there and the hips are tilted backwards, it's actually tilting the ligament up. So it means it's pushing the bladder into the pubic bone itself. That's where you that's why you have a leaky bladder, or a lot of times women will say I have a small bladder. Really common. Like the most common thing is I have a small bladder. It's not a small bladder. Your bladder it didn't change size. It just got squished. So it doesn't have the capacity. And the bladder has a mechanism in it that says when I'm this full, let my brain know so that I can let it go. So it's a pressurized mechanism, right? Does that make sense? So if this is hip this way, or conversely, if it's turned this way, that will then, if it's turned that way, then it will then push pressure on the uterus another way. Now remember this guy here, this is the Lily Alba. So let's get rid of the Lily Alba. Okay, so back again here. So if it's rotated this way or this way, there's going to be some sort of strain on the uterus. Now this also happens when women are trying to conceive. If there's too much strain in the uterus and there's too much positional strain in the uterus, it causes stress. And then the body's not likely to be able to hold the baby. So if the body can't hold the baby, then it's not going to conceive. Like the body will only hold the pregnancy if it can conceive, but if it can't, if it sees a problem there, it won't. I know you get abnormalities, you get like a fallopian tube pregnancy or something like that, but generally, in general form, this is how it works. Okay, and there's always exceptions to this. So what we can do now, if we put the organs back on there, so underneath here, we got, okay, this is where the ileocecal valve is in here. And this is a big one, causing bloating, gas, and distension there. So the valve between here and here gets disrupted. And usually that valve is normally going to sit in this area right in there. And the appendix is there too as well, in that general glands area. So if this valve gets disrupted, what it does is it causes bloating, gas, and distension in there. And that's where a lot of autoimmune symptoms, because if the valve is slightly closed, the stuff flowing from the small intestine doesn't make it properly to the large intestine. It backs up and it creates sludge or basically a buildup on the small intestine. That buildup is going to show up as skin irritations, skin infections, rosacea, rashes, stuff like that. Okay? So again, getting rid of these guys here. Let's get rid of it. And then let's get rid of the large intestine here. Whoops. Okay, so basically now what we want to do is we want to get this. So if the prolapse can happen in a lot of different ways. So again, remember all of this stuff was being held up by fascia. So we had the intestines, let's come back here. So we had the intestines all through here, and then we had the ligament right here. So if these intestines are sitting down and the hips are tilted forward, that's going to actually change the shape of the uterus. Does that make sense? That's what that's what a prolapse looks like. It's too much internal pressure pulling down. So if it's pulling from the hips, pulling down, so two ways to look at it. If there's too much adhesion in here, it pulls on all of this downwards. And if it's pulling it downwards here, then that's going to put pressure on there. The other could also be true, but not likely, where it could be pulling upwards because most people sit, so it's mostly downwards. And then it's that anterior tilt. Now, if there's a lot of trauma in here, if there's like uteral trauma, if you got, let's say you got a lot of trauma right here. Okay, let's take out this. I've taken out the glutes already, so the glutes there, but here's and the glute minimus and maximus. But if I was to remove this, okay, well that's also going to cause trauma too, because look at there, right in there, that's connected right to the pelvic floor, all those muscles. That's the uterus right there. So if I was to isolate this, that's what it looks like. So any of the muscles touching that, so if these hips, remember if these hips are off, so and a lot of people have this, if one hip is higher like this and one hip is lower, this is going to cause this to dysregulate. So that's going to cause the uterus to tilt. Tilted uterus is really common, like it's super common, and that can cause a pregnancy issue as well. Okay, so let's go back here onto there. And then this is where a lot of the danger with women today getting, exercising their glutes, causing this unusual pressure or weight distribution in the body. When you enlarge the glutes, which is the popular thing to do like this, you enlarge those glutes, it puts a lot of pressure on here and down here. And that pressure pulls on the lower back there and pulls up here because the glutes go out this way. So that causes a compression in there, which then pulls on these muscles right here, pulls on this guy right here, and then there's other ones that like more specific, like right here. If we pull that up like that, see that little guy there? When he gets pulled, he pulls directly on the uterus. These are all things that contribute to it. Does that make sense? So the very first thing when we look at somebody and we do fascial work, especially fascial maneuvers, you're going to see some behaviors. Let me go to photos here. Photos. You're going to see some behaviors here. And let's go to all photos. And let's go over here. Let's go to favorites. So let me show you what it looks like here. Okay. Now this isn't extreme, but you see how the hips are tilted forward and the belly comes down. So what we were saying there is if that belly comes down, that's pushing the intestines down front on the bladder. Well, that's putting pressure on the uterus as well. So bladder and uterus. She has a scoliosis and also a prolapse. Okay. So if you look at here through the course of 2 months of the 20, this is not, no practitioner touched her. She did this all herself. So this is 2 months of her doing it herself. So what you're noticing is in between here, it's getting longer and it looks like it's leaner, but she's not leaner. She's got more space between here and here. So just more space. So that is opening up. So that's going to pick up the entire abdominal cavity. It'll pick everything up off the pelvic floor. Now what stops it, even in this case, if it's like that, is if there's too much adhesions around the pelvic floor. Then what's going to happen is she might be here but feel super tight and like have a lower back or something that's really tight. That all makes sense? Yeah.